Okay, ji, Bismillahirrahmanirrahim. I welcome all of you in the second session on poultry diagnostic techniques, diagnostic approaches, and this is fourth session of this week, last session of this week. And this is the first slide only just to remind you. We have to take clinical history, signs, necropsy, then tentatively rule out a list of diseases, and then for confirmation submit sample to the laboratory. Yesterday we discussed about the respiratory and musculoskeletal diseases. Today we will discuss about the digestive diseases and nervous system diseases. So digestive diseases, there is a generally there is a high mortality, anorexia, bird become off feet, sometimes bacteremia lead to fever, and dull and depressed bird, lethargic birds, dehydration, very important sign, because generally bacterial diseases have a long duration as compared with the viral diseases. Then there is a diarrhea, very important sign, loose dropping, that may be watery, may be bloody. Then vent pasting, very important, lean, a sign of digestive diseases, and wet litter material. If we will do the necropsy, then we will see the intestinal mucosa. What about the thickness of the mucosa? Is it thick, thin? And what about the lesion in the mucosa? Is there towel-like appearance? Is it hemorrhagic? Then very important, intestinal content. Like you can see here, there is undigested feed in the intestine. Then you will also look for the parasites. So for the parasite you have to open the entire length of the intestine, and then any specific or pathognomonic lesions in the intestine. So this is briefly about the situation of the intestine. Then very important, intestinal mucosa, there may be ulcers like in the Newcastle disease. These ulcers may be of different size and shape, may be oval, may be lenticular, may be round, may be bran-like ulcer, may be longitudinal. You can see in the lower one there is a corrugated appearance, upper one is a typically butter-like ulcer. So but keep in mind, you have to differentiate the ulcers from fine blood spots, because in case of the ulcers there is a raised areas having tissue debris and yellowish material. So you have to clearly differentiate between ulcers and fine blood spots. Now you can see this, sometimes there are ulcers are also present, maybe in the ulcerative enteritis caused by Clostridium cholinum. Sometimes such lesions in the intestine also occur in the histomoniasis, that is Histomonas mediagritis, but mostly in turkeys. In the lower two you can see the typically blood in the ceca, that is a protozoa infection caused by coccidiosis, by Amelia, but specifically in the ceca there is Amelia tenella. In the interior one third there is the Amelia cervulina, and the middle third one is the Amelia necatrix. On the basis of these gross lesions signs, then you will rule out a list of diseases. If I recall in my mind about the enteric health related viral issues, then this is very important: hemorrhagic enteritis virus, Newcastle disease virus, that also lead to lesions as we have observed, and turkey coronavirus, that lead to coronavirus enteritis in the turkeys. And if we keep in mind bacterial diseases, these are most important regarding the gut health. Clostridial diseases, necrotic enteritis and ulcerative enteritis caused by Clostridium perfringens type A and C. Then salmonella also lead to very important enterocolians and enteropathogenic E. coli that also lead to enteritis in the birds. Regarding the parasitic diseases, we may suspect coccidiosis, intestinal and cecal coccidiosis, histomoniasis caused by Histomonas meleagerides, that is also called as blackhead disease, and intestinal helminth parasites like tapeworm and roundworm, and very important cause of gut health mycotoxin, aflatoxin, ochratoxin, zearalenone. All these mycotoxin have a common lesion of enteritis. And then other feed related problem, sometimes fat rancidity or other problems that also may lead to the gut health issues. Now, after this tentative diagnosis for confirmation, what type of sample we will submit in digestive tract diseases? We will submit the intestine, liver, or other organ for histopathology. Intestine, liver, spleen, and swabs may be for bacterial isolation. Intestinal scrapings for coccidiosis for the slide preparation, and impression smear, like we can use impression smear in the spirochetosis. Then the feed sample may be submitted for toxicity for mycotoxin. Feed sample must be submitted from different places, also from the feeders, and after thorough mixing. Then the tissue samples may be submitted for PCR or RT-PCR, and also we have already discussed for the histopathology, you can submit the tissue sample.